of the Personnel, Public Information, and Health Committees. And I know that there are some, can y'all hear me back there? No. Rosie, what do I need to do? Get closer? Can you hear me now? Oh my God, I have to be like, it has to be like. All right, this is a joint I'll start over. This is a joint committee meeting of the Personnel, Public Safety, and Health Committees to discuss the scabies outbreak and the effect on Metro employees. This is the second meeting that we have had on this. My Personnel Committee held one on June 6th, and so I appreciate the other committees joining us for a follow-up. I know that we have been here, it seems like every day for about 15 hours a day through our budget process, and a lot of us are at planning tonight. So I know that some people are planning on coming and meeting us later, and I understand if some of y'all have to leave to get to other meetings. And so I'm going to have I've got an opening statement. I'll see if the public safety or health committees want to have any sort of opening statement, and then we're going to ask a representative from each department to come up and join us up here, and if we've got extra at our side tables, so we can have a discussion on some more questions on this issue. And so Rosie is handing out to our committee members and council members some handouts in our packet, and if we have leftovers, we can share that with others. So today's meeting was originally called to address the serious health problem affecting our courthouse employees. An outbreak of scabies has infected sections of our courthouse, and many courthouse employees have been affected by this. This outbreak occurred due to a lot of lack of oversight and disregard for proper intake procedures at our jail, it appears. Make no mistake, this problem was avoidable and should never happen. But it did happen, and so today's meeting is designed to hopefully identify specific causes of the outbreak and help find solutions that can be implemented quickly to ensure that this serious health problem does not arise again. Unfortunately, the private contractor, CoreCivic, better known as Correction Corporation of America, who is responsible for overseeing the intake procedure and managing our jail, has decided they are not interested in being here today. Given ample notice, their representatives have made it clear to me, to this committee, they simply don't believe that they are beholden to the identity that pays their contract, and their absence today speaks volumes to me, and I hope it does to you. It's unacceptable. So while we focus today on how we can correct the current problem and prevent future scabies and other outbreaks, I want to make it clear that the behavior of CoreCivic is completely unacceptable and raises serious doubts about their fitness to continue serving our city in their current capacity. No private contractor can operate with the level of complete disregard that CoreCivic has shown on its own failings that were both preventable and that had severe consequences for Metro employees and others that work in our courthouse. Going forward, I will be urging my fellow council members as well as the administration to examine what actions are needed to that are needed to ensure that CoreCivic either fulfills their obligations or otherwise I will work with my fellow council members to ensure that they no longer work with our city. So with that, I think if the health or public safety, do y'all want to add anything before we begin? Okay, so I know today we've got representatives from our Sheriff's Department, our Health Department, and HR Department. If y'all want to join us up here, we'll turn you on for any opening statements y'all have, and then we'll start questions and discussions. And I'll also note that we have members of our Metro legal team at the legal table. And if you'll bear with me, this is, I think, only my second or third time up here, so I hope I don't mess up the board. And I should have just turned on all three mics. And I know that, I think I just turned y'all on over there at Metro Legal. So if y'all want to take these, if we need to take over at planning table, that's fine too. Sheriff, if you want to begin, we'll let you we'll let you begin. And I guess before we do that, I'll also acknowledge that we do have Judge Melissa Blackburn with us, and Judge Dozier has joined us as well. And I think that's all of our elected officials that I've got in the room outside of council members. Thank you, Sheriff. Please feel free to go ahead.
Yeah, thank you. I just want to kind of explain the role that we play and who we are in this situation. The word jail always makes me a little nervous because we run the intake of all arrestees, the sheriff's office does here in Nashville. And then soon after the processing of, or called booking, occurs, and they're transferred, the females will be transferred to what is the core civic facility on Harding Place. A couple things just to remember, and I think it's worth noting for all of us, is that the outbreak, or the word scabies, is not new to us in corrections. On average, the sheriff's office jails have some 8 cases a month in its facilities, so there's someone with it every day, and we're managing that as we have for years. I think in the best way possible. It's not easy. The environment's not easy to do that in any correctional setting, and so I think that's only fair to point out. Clearly, there are things that we could all do better, and we can talk about improvements, I think, going forward. But I did want to point that part out. The other thing that confuses people is the contract is with Metro government that Core Civic now has. The sheriff's office has a monitor on site, one shift, but every day of the week or 5 days a week, to oversee or to monitor the operational functions at the facility. I think it's about 7 or 8 or maybe years ago that we asked at the time for an additional monitor to come from the health department to oversee the health issues related to the contract out on site, because our staff don't have the expertise in health, as you can imagine. Some people don't even understand this, that the health department actually oversees the health of the inmates in our jails, so we don't even oversee that ourselves either. So it's just something to note. We have a monitor on site. I know Dr. Paul will talk about that as well, but the sheriff's office has a person there who's watching the operational functions, and I think the health department has one there to oversee the health as it's being performed on site. So with that, I'll pass it on and answer any questions.
Dr. Paul, your mic should be on.
Okay. Good afternoon. I'm Dr. Bill Paul with the Metro Public Health Department. Are you hearing this? Somewhat? Okay. First, a little bit on scabies. As the sheriff said, scabies is not a new disease. It's not a new condition. It is something that happens in anywhere, and it can happen anywhere in Nashville at any given day. But it is something that in the population being admitted to the DCSO jail, as he said, it's around eight patients a month, or 8 inmate detainees a month that are diagnosed with scabies. Most common symptoms of scabies are intense itching and a pimple-like skin rash. It's caused by a mite, which burrows under the skin and lays eggs. The mite doesn't move super quickly, and it doesn't fly through the air. The mite has the easiest time of being transmitted from one person to the next with significant and prolonged skin contact. Not prolonged, I mean, but a usual handshake or a lot of the kinds of interactions that we tend to have are not typically significant enough or long enough to spread scabies. But longer contact can do it, and then certainly outbreaks do happen in places where people are living together and in fairly dense circumstances. And so prison outbreaks and jail outbreaks have happened before and do happen. Other places where people are in congregate living situations, you do see once in a while an outbreak of scabies. It's itchy and it lasts a long time. But it is treatable, and so either with a cream or with a oral medication, scabies can be cured and the problem typically ended. The itching complications, people don't usually end up in the hospital, but you can get sores that are infected, and it is a really uncomfortable and a not something that we want anyone to have, whether they're detainees in the correctional system or our own employees in Metro. When we do have an outbreak, as we do now, and we're calling it an outbreak of presumptive scabies because the rashes look like scabies, you know what they say about a duck. If it looks like a duck and it quacks like a duck, this rash, several different physicians have looked at different patients with it and said it's compatible with scabies. We don't have laboratory proof that this outbreak is from scabies. That doesn't bother us too much because the lab you do to prove scabies is rarely done. And you know, we're trying to find opportunities to actually get the lab test done and confirm the diagnosis, but it is not unusual to be trying to control an outbreak of scabies without lab confirmation of the cases. But in addressing an outbreak, our number one priority is to address the outbreak, and that is to stop spread and stop transmission of the condition or the infestation. Our second priority in terms of what we've been doing as the health department has been to basically track the outbreak. So understand where the cases have occurred, make sure that we're monitoring for cases, particularly at Core Civic, so that we become we become aware immediately of any new cases that occur in the Core Civic facility. And we've also, through the IOD clinic, set up the ability to detect new cases in Metro employees who have gone to the IOD clinic. The third thing we're doing, so control the outbreak, track it, that is, describe it and make sure that we're monitoring for new cases so that we can tell whether we've actually controlled it. The third thing is to communicate with folks. And so hopefully everybody in this room, certainly a lot of folks in the Birch building have been receiving frequent communication from us. And our main intent is to keep people up to date, to tell people what to be alert for, and if they have symptoms or have concerns, what to do about those. So those are the top three things on our list of focus right now. The fourth thing is really to look at this whole event and to try to determine how we can prevent an outbreak like this from happening in the future. It's hard to make any comments about that while we're in the middle of controlling the outbreak and investigating the outbreak, but it is clearly something that we always do in the health department. We always want to do at the end of an outbreak is find out how could we have prevented this. So we have relatively little to say about that at this moment because we're still focused on making sure that we're not seeing new cases. So the basic approaches are find cases and make sure they're treated. If you're in a correctional setting, it's important to realize that this can take from 2 to 6 weeks to turn from an exposure, a mite that gets on your skin, to turn into an itchy rash. And so that's what we call the incubation period. And so if you treat everybody with an itchy rash, there may still be some people in the population that are incubating and could show up later as cases. And so with Core Civic, we started with really identifying a number of cases in the women's units, and we directed them to treat all women. And we call it treatment, but it's basically a preventive medicine given to all women on that unit to prevent the possibility that they'll develop a case. And then within the last week or two, we identified some what looked like cases among men, and we also got a better understanding of sort of what all the interaction is within the populations. And so we recommended that they complete that preventive medication for all detainees on site, and that was completed this last weekend. And so both with identifying new cases, making sure they're treated, making sure they're not traveling until they are treated, and also with treating the entire population as a preventive measure. We are now kind of in a monitoring mode with Core Civic. Our most recent detainees that have been presented with a rash, the most recent rash onset in that group, actually I think it's the the 13th, June 13th, is that right? I'm looking at the, I brought all the lists and then I'm looking at the wrong one. So we had some suspicious cases or possible rash onsets on June 10th and June 13th and none since then. Part of what we're doing on site at CoreCivic with our monitoring activity is to look at sick logs every day. So we're not waiting for them to identify something that they're suspicious of and send it to us. But any detainee who's requested sick log, we look right into the system and determine folks that have showed up with rash, and then we investigate the records. And so we have a way of finding out in a timely way people who have complained of a rash on site. So overall, we have very few cases with onsets in June, and we're just still trying to make sure that we've got a good understanding of the outbreak and that we're doing what we need to control it. With regard to the Birch building, the total number of folks who have been treated that are Metro employees as of the last count was 47. It's important to remember that some folks of those will absolutely probably be individuals who have the classic rash of scabies and unfortunately were exposed in this particular setting. Some of them will be people who were treated as a precaution. So they had a symptom and that they were worried about, and the doctors in the IOD clinic kind of wanted to err on the side of making sure they didn't miss treating somebody who could have scabies. And so there are probably, one of the things we're doing in the next couple of days is going through the medical records of all those people to take a look at the description of the rash and make sure we have a good understanding of who got a scabies-like rash and when they got sick. So it's an investigation in progress. I think we're doing the things that we need to do to get it under control, and we remain interested in communicating with folks and also hearing about either concerns or about new cases. So I'm going to stop there.
Touch on the if the HR department could touch on the mayor's letter and the ongoing what we're doing about employees. Y'all still can't hear me? Now? Am I on now? Off. Can you hear me now? Okay, thank you. So if the HR department will touch on the IOD process and the overturning and the decision-making on the employees getting reimbursed and things like that too, and address the letter that the mayor sent yesterday as well. And I'm turning you on. You should be on now.
Okay, thank you. John Kennedy, Metro Human Resources Department. The Metro Human Resources Department manages the contract for an IOD clinic. The IOD clinic is a place where Metro employees that are injured on the job can go and seek treatment for their situation. Typically, people present at the IOD clinic because they have a physical injury, something that's obvious that they cut their finger or they broke a bone, and they receive their treatment. In this particular situation, this outbreak had to find its way to the IOD clinic. Most people that have a rash don't assume that this is something that's work-related and don't first seek treatment through their employer for this. They'll go to a private physician. They may be diagnosed and be given medication to be treated for that. At some point, somebody tied it to, maybe this is related to, what's going on at the jails, and showed up at the IOD clinic to be treated for this as a work-related issue. So that day was the first time that this became an event that we had surveillance on. Up until that point, we had no idea that this was going on. So immediately we got in contact with the health department. We don't know anything about scabies. We don't know anything about how it transmits or how it affects people. So it was not, we wouldn't have been serving anybody's interests if we had jumped out that day and started ringing alarm bells. Instead, we worked through the health department to try to find out what was going on, who's affected, and participate in that way. Employees that had the treatment through the IOD clinic, their treatment is covered at 100%, including any medication. For people that have gone to their private physician, been diagnosed, and gone to the pharmacy to get their prescription, then they would be covered under Metro's medical insurance. There's a group of people, you know, when you go to your medical insurance, there's a copay or a deductible. As we understand it, there's a one group out there that's kind of a gap. So in some cases, employees might have gone home and a family member may have contracted the scabies as a result. They go to their private physician, they get a prescription, they go to the pharmacy, they make their copayment. The ask there has been, can we reimburse those people? And at this point, we don't really have a way to reimburse those people. Our medical plan pays what our medical plan pays. They're not Metro employees, so we haven't found a way to cover them under the IOD clinic. If the employees have one insurance, the copayment on the medicine is very small. If they have the other insurance, the copay is a bit more significant. We continue to work on that. Any employee or their family member who feels like they've been affected by this outbreak can go to the health department, be treated there, and receive the medication there. Again, if somebody's been to their own physician, they've already incurred out-of-pocket copays, out-of-pocket expenses toward the medication. That's what we don't have a way to reimburse at the moment. There was a request that Metro reimburse these claims. So people have filed a claim with Metro Legal. I'll let Metro Legal address that further if necessary. But Metro Legal, when a claim comes in, reviews it to see if the city did anything wrong, if the city has any liability, and if so, then they reimburse the claim. In this case, I think their findings have been that Metro didn't really have any liability in this. It was just something that happened. It happened to happen in Metro facilities. So at this point, those claims have not been reimbursed. Yesterday, the legal department did say that Mayor Berry's position on this is she would rather see Core Civic, who is responsible for this outbreak, to bear those expenses and reimburse our employees.
Thank you. And so before we go on to taking council member questions and discussion, I will, I'd like to point out that Public Defender Don Diener has joined us. Thank you. So John Cooper with Legal, if y'all want to address the letter that Mayor Berry has sent out for that employees who family members need reimbursement, how are they supposed to go about getting that reimbursement from Core Civic? Wait, let me turn, I don't think you're on. Okay.
Okay, at this point, we do not have an official response back from Core Civic. The mayor's letter just went out to them yesterday. I have not seen a response as to whether they are willing to do that. If they are, then they can work with us to facilitate how to get those payments and how persons who have incurred out-of-pocket expenses can make claims. But at this point, we don't have an answer yet.
Okay. We're going to start with Council Lady Sharon Hurt.
Thank you, Madam Chair. Thank you, Sheriff and Medical Director and HR Director for being here, and Metro Legal as well to address these issues. I guess my concern is, well, first of all, I'm not familiar with scabies. Just found out I know somebody now who has scabies or who's had it, but I've never heard and never known of anyone to have it until this situation occurred. My first question is, are there doctors at Core Civic in their facilities?
Oh, let me turn y'all on. I'm sorry. Okay, Dr. Pollen and Sheriff, y'all should be turned on.
Yes, that's correct. Part of the contract is for them to provide 24/7 medical care. The physician is, I think, by the terms of the contract, 40 hours a week, but they are required to provide all necessary medical care to the detainees that are there at the Core Civic facility.
So I guess my next question would be, well, how was the Public Defender's Office made aware that there may be some problem that needed to be investigated?
And if Defender Diener would like to answer that, we welcome her at that podium. And when I learn how to turn that on, I will do so. I think you're on.
Okay. Am I on? All right. We had started receiving reports from clients, frankly, of them experiencing a rash and not really being satisfied with the way that CCA or Core Civic was responding to that. So we received enough accounts of that issue that mid-May, one of our attorneys sent out an email within the office to attorneys saying, hey, lots of us are getting these issues with our clients. Just want to give you a heads up that there is a suspicion that it's scabies, but they're being told it's not. And it was when that email went out at my office was the first that I had heard about it. And so I immediately responded that with the attorneys who were communicating that we should reach out to the sheriff's office contract monitor, as well as potentially reach out to the health department if we didn't feel like we got an appropriate response from CCA or from the contract monitor.
So is it safe to say that the clients possibly communicated their concerns to some personnel at Core Civic?
Oh, absolutely. Absolutely.
Okay. And considering that Core Civic is not here now, nor have they responded to Metro Legal, or, to the mayor's office or anything, are they in violation of the contract in any way that Metro has with them?
I think that's going to be a question for Metro Legal.
At this point, we don't have enough information to determine whether there has been a material breach. The health department is still completing its investigation, and then once that is done and we get the complete set of facts regarding who knew what when, then we can examine whether there has been a breach. But at this point, it's still too early to make that determination.
And this is my last question. I don't know. We've been having so much budget information sent to us. I can't recall if any kind of correspondence has gone out to family members apologizing about this situation, because I think that Metro should let the people know that they really do care, and that this is an unfortunate situation that has occurred, and that we're working very diligently to make sure that everything is being done that can be in the best interest of the employees and their families, because I think they are first and foremost important in this particular situation. I know that it was stated that this was just something that happened and I don't think so, because I was scared to death when I found out that I possibly could have been subjected to it, and my daughter, and then all of my family that I visited, and it just was going on and on and on and on, and I didn't know what to do. And I did also go to IOD, and they didn't treat me. So, I am a little concerned, but it would make me feel better if somebody gave me a hug.
Well, Council Lady Hurd, I think we have gone.
Well, they may not give me a hug because they might think I got.
I think that I believe this council, and you were a sponsor of the sexual harassment policy training that we've undertaken. So I think the council members here will spiritually give you a hug.
Okay.
And at our last, I'll remind you, at our personnel meeting 2-3 weeks ago, we as a committee did apologize and want and to the departments that were there, ask them to express to their employees. And so maybe as a council, we do need to take that up as a letter from us as a body, and that's something that we can definitely discuss and address. So thank you. And then we're going to go to Councilman Pulley. Nope, sorry. Go ahead.
Thank you, Madam Chair. First, before I begin the few questions that I have, I do want to make a statement that I think we need to all understand that as council members and part-time legislators, we've been called on to do an awful lot of things over the last few weeks. We just left a pretty intense budget time period where we drilled down on this budget and made probably the largest change in the budget in the city's history from the council's perspective. That took a lot of time and attention to drill down on that. We've just finished second reading on an immigration bill, and that's a very complex issue, and it took us an awful lot of time to drill down on that as well. We've got a short-term rental property meeting coming up next week where there's some pretty significant legislation we're going to have to speak on there as well. So council members have had very limited amount of time since this thing happened to really drill down on facts and look into this, take a deep dive into this issue. So we may not be as prepared to be here as we like to be someday. So there's a lot left to be done to satisfy us that we really have a real good factual analysis of everything that happened. That said, the majority of the questions I had today would be for Core Civic, and they're not present. But I do have some things that Dr. Paul and Sheriff Hall might be able to address. So I may toggle back and forth between the two of you as I ask these questions. So my first question is with regard to, it may be procedurally. I'll ask you, Sheriff Hall, and then I'll go to Dr. Paul. Can you tell me, from a correctional officer's standpoint, what the buzzwords are, or what would trigger concern on the part of correctional officers when an inmate comes to you and talks about their health, that there could potentially be a problem with a rash like scabies?
Yeah, I think I can try. Maybe I can give the way the process is supposed to work, and I'm surely not claiming it happens perfectly every time in our operation either. But the inmates have a sick call procedure. Basically, there is a kiosk situation where they can actually ask for a nurse to check out whatever the ailment may be. That's what we would steer the inmate to, have he or she fill out such a protocol to start the process. After that, as Dr. Paul mentioned, in our own jails, we have doctors on call and doctors present and nurses throughout the day, and they go and respond to that inmate's need or issue. I have to tell you, in a jail environment, airborne diseases are far more complicated for us, and we panic, as you can imagine, because you have a lot of issues to worry about there in a large volume situation. In a situation like this, when a person complains of the rash in our own situation, any rash, we would want medical to tell us what to do next. That's how we live. Is this a rash we need to worry about? Is this a place or a person that we need to isolate? And I think that's the way you would want it to work, because the medical staff should then prescribe the appropriate care. They should know whether it's contagious enough for us to move them into general population or into a courthouse and so forth. But I'll tell you, too, that it's fair to say that I think the medical staff in a correctional environment do a really good job of not prescribing, but over diagnosing it because of the potential spread of something like this. If you had a rash and went to the nurse today, I believe it's very high probability they're going to treat you like you have what is the scabies symptoms if you had such a rash, because we want that. We want you to get the medication in you and get you started on the protocol. So we want the inmate to take responsibility to sign up, and then that starts the process, and we want the nurses to tell us what to do next.
So the nutshell version of that answer is if somebody complains of any kind of rash like that, you immediately, and in my opinion appropriately, kick it off to the medical personnel and say, hey, I want to have this looked at. Well,
Let's take responsibility to the inmate first. It's nice to tell your lawyer. That's a good idea, but that's really not where they need to go. They have a medical procedure and a protocol and a policy that they must follow, which is to sign up to see the nurse. And the nurse would then diagnose what to do next. And so if they've done that and then told the lawyer or the correctional officer, those are fine things to do. But we want to steer that back to the person to make sure they're appropriately documenting their own need.
And they're aware of that procedure?
Better be, yes, sir.
Okay, all right. And I would follow up with Dr. Paul. Could you tell me, in as detailed a fashion as you can, from start to finish, when an inmate comes to you or to medical personnel with a concern about a skin rash, what the procedure is to examine and potentially diagnose what the problem is?
Okay, so again, these are CoreCivic employees. The medical team at the jail is CoreCivic, and they are all licensed medical personnel, so the physician, the nurses. And so they would have their own procedure for handling that sick call, bringing the person to the medical facility on site, having them seen by the appropriate personnel, and then making a diagnosis. I will say that in this particular instance, the physician had seen some rashes, but was not thinking that they were scabies, and it was the middle of May. They reached out to our contract monitor and said, we've got some rashes, and we're going to do a variety of different tests to see if it has to do with mold, with heat. We had a issue with the furnace system. So a variety of different things that they were thinking of. But at the beginning, what they saw, they weren't thinking about scabies. And so it was actually at the end of May that I first heard about it. And I'm joined by my two real medical experts. Dr. Shaw Kaikai is the infectious disease expert behind you, and then Dr. Gil Wright is the civil service medical examiner. So on taking an assessment of the entire situation, Dr. Shaw Kaikai said, this is scabies. You've got to treat this like scabies until proven otherwise. And so that's the point at which we went into control mode for a presumptive scabies outbreak, with both treating patients for scabies, but also inmates for scabies, but also these preventive treatments that I mentioned earlier.
Okay, let me go back to my original question, which was, and I'm not asking you to get into the mind of CoreCivic employees or anything like that. Mm-hmm. What I'm trying to do is gain an understanding of what happens from a medical perspective when someone comes to you and says the magic words, I've got things on me, or whatever they say, that it's a skin rash, or I've got itching. So if I came to you and you're my doctor with that kind of situation, what would you do to diagnose it?
I would say I'm a public health administrator, and I'm going to turn to one of my clinicians to take a look at it. But I would basically try to look at the rash, listen to the symptoms, find some information about exposures, and then make a judgment about what kind of treatment to provide. One of the things I'm in terms of CoreCivic itself, we are the contract monitors, but that doesn't mean that we have a full medical team that is looking over their shoulder on every medical judgment and every diagnosis they make. If we were doing that, we might as well just be providing the medical treatment. But it's like any other physician's office, that they go to the doctor, and the doctor takes a look at it, and they make their best judgment about what the diagnosis is and how to treat it.
I understand that, but you're the doctor, and I'm trying to drill down on what specific measures you would take. And so that's what the question's designed to get at. You scrape my skin? Would you run a black light over my jail cell?
Dr.
Or
Wright, you want to give it a
tell
shot?
me what you would do.
We'll pass this over to, if you'll introduce who you are and what you do for us.
Am I on? Okay. I'm Dr. Gil Wright III. I'm the CSME, and what the process is supposed to be, or what I understand it to be, having just briefly looked at core civics, policies, procedures, and that. When a inmate reports it, they report it on their system, then a nurse is supposed to come and evaluate them and make a decision as to where the next steps are. That could be, there are some standing orders that they could be given medications for certain things. If they don't see much of a rash, that type of thing, it's their clinical judgment, and it's hard for me to second guess what that clinical judgment is because I'm not seeing it at the same time. Given that, but if they have certain set policies that if the rash doesn't go away, if there's certain findings, they are then to escalate that up to at least a nurse practitioner, if not the physician. The physician's not always there, and sometimes that. So
Right,
then they would be seen.
I heard you say the nurse will evaluate them. So can you tell me what is involved in that evaluation process?
I don't know. That's a core civic process. I don't know that process.
So
I've been in this position 2 weeks, sir, so I just know briefly what in my office, what I'd expect is for them to look at that, take and see what their symptoms are, what their findings are, and then that would come to me for an evaluation. But I can't speak to their processes. I can only speak to the brief bit of things I've seen on what their process should be.
All right. So back to if I come to your doctor, if I come to you and I'm in
Yes.
your office and I don't have any idea what the procedure is. I have no idea what you guys look at when you look at skin rashes like this. And I've heard a half a dozen different things. So I'm just trying to understand what the process is. Because I know in my old world, if you said magic words, then automatically this is kicked in and we have to do these kinds of things because, they said the magic word, sexual harassment if they use the H word, wow, we've got to have a sexual harassment investigation where there's any factual basis to that claim or not. So if they say I've got a skin rash, I would certainly think that you'd want to attend to that. And I'm just trying to get to the procedure and the process medically of what it takes to appropriately evaluate someone who comes to you with that concern. Does that make sense?
Sure. Again, I cannot speak to core civics process.
And I'm not asking you to. I'm asking you to speak medically at what it would take to
medically
evaluate.
would be the typical medical exam. You would get a good history, finding out what the symptoms were, what they might have been exposed to. If this was, then you'd take a look at what the exam shows, what the rash looks like, and then you would make a decision based on that. Scabies is usually a clinical exam, meaning we don't use diagnostics. The test that we use is very low yield for that, especially in somebody that has only a few lesions, few little bites or marks. I will say that since we've been doing this, we have had discussion with the CDC from our office, and they've said we're doing everything that they would recommend that we do. But then once you made a decision on what you thought that was, you would treat the individual, and then you would see them back in a timely manner to see what their response is. And then you'd continue to monitor, you'd re-examine, and that would be an ongoing thing until they either cleared up, or if they weren't clearing up, then the next step would be to refer them to a specialist, to a dermatologist. And in this case, a number of these people have been seen by dermatology, I think at least 3 different dermatologists who have all said this looks like scabies, but themselves have not done any scrapings or anything else either.
Okay, I won't go any further with that question, but so I'll go back to Sheriff Hall. I understand you got a difficult thing to manage with, because we all know that inmates are going to try to pull the wool over you eyes from time to time, and I'm sure that's nothing new to you. So how do you manage that when somebody comes to you with medical concerns about, I guess my question is geared at the legitimacy of those concerns and how you, what procedures you have involved to evaluate that component?
This is probably not the most professional thing to hear, but
Go ahead.
we better not be playing doctor. People that work for me aren't doctors and don't need to play doctor, and I think that's some of what's going on. We need to be careful. There are medical people who know what those treatments need to be, and we better listen to what the medical staff tell us to do. And our officers and staff that work there, we live there 24 hours a day. I mean, our staff are exposed more than anybody in this room, anyone that's ever been claimed so far to be involved. So we worry about these types of things all the time. But the first thing we do is we don't doubt what the inmate's saying. We first and foremost want the medical staff to tell us that. I do think it's fair to say that we also have staff who have brought concerns like this as this. I mean, I've been doing this a long time. We've had scabies outbreaks before. I've had situations like this back years ago, and we've been through this. But I think this is the most exposed in media and conversation I've ever seen about it. And we've had some staff, and just so you know, who have never been in a courthouse since all this, has never been in contact with CoreCivic. One of our managers, and she was concerned because she'd read about it and heard about it. And I think went to the IOD clinic and came back, and I asked, she's a friend of mine, and I asked her, what did they tell you? And she said, possible scabies exposure, and they treated her. That's what I'd want them to do. I'm not doubting that you have a rash, but I'm not telling anyone she has scabies either. I think what we have to be careful about is she's been exposed. We don't even know that. She's never been in the courthouse or CoreCivic. So I just think we have to be careful. I think there's a rash, and it's being treated. I'm not a doctor. My staff aren't doctors, and we need to listen to what the medical staff tell us.
So the bottom line is when someone comes to a correctional employee with a medical concern, it's not your role to enter into that discussion at all other than to kick it off to medical personnel. And I did hear you say something about there is an appropriate procedure for that, and you would ensure that that procedure is met.
Yeah, we better. That's our job. I'm not saying we do it perfectly every time, but that's what we expect of our staff. You don't second guess. You don't diagnose. And once the medical staff give us that direction, we better restrict the movement. If that's the case, move the person if they need to be. And in some cases, as I said earlier, there are far more diseases more difficult to manage than this one. TB is one of those that we face all the time. And so you're worried about it, and we better have our staff listening to the medical staff.
Okay, thank you. I want to move on to one other topic, and then I'll be finished and leave it for everybody else. But there's been an awful lot of talk about the contract with CoreCivic, and it's a Metro contract, and who has the ability to really oversight responsibility for that contract, and whether or not the contract's been breached. Could you speak to the complications that would result potentially if people were to go down a path of terminating that contract? It seems like that would cause some concern on the part of the sheriff's office actually staffing that without CoreCivic. Is that true?
This is a very complicated situation, and I'll do my best.
You handle complex things very well, Sheriff.
I don't know about
ahead.
that. I don't know. Let's remember, these are state inmates. They are convicted of a 1 to 6 year sentence. They are convicted felons, is another terminology. They are paid for by the state of Tennessee. The contract that the county has is with the state of Tennessee to house those inmates, and then the county has chosen over the years and the state to subcontract that to a third party. It gets very complicated if hypothetically tomorrow morning the contract was severed with a private company. The first decision that we need to make as a city is, do we want to be housing state inmates in our county for the state of Tennessee? If the answer is yes, then we need to be prepared, and we, as in hopefully the sheriff's office, would be able to tell you relatively soon how long and how much that would cost us to do that. I think I've had this conversation a while back with Councilman Member O'Connell, and I said to him, I think it would be a healthy and a good exercise for us to bid on such a thing at the right time, and you guys would evaluate it, or however the government decides on the selection of it. But it would not be as simple as we're frustrated, we need to cut someone out, because the state of Tennessee would have to agree to pay. It's their inmate. That contract also has the facilities tied into it. I could go all night about who's paid for it. It's state funds, most of it there. So you'd have to negotiate a lot of things out. But I do think if you get to a point contractually with a private company, we need to have a long conversation about, is the first decision to let the state take it back? And if the answer is, well, let's bid on it, and then we could go forward. But it's a very, very complicated situation. I had a long conversation prior to scabies with Councilmember O'Connell about that, and committed that when the time comes, which is not that far down the road, I think it would be healthy for the city to forward a bid and let the city decide what it wants to do.
Okay. Thanks very much. Mr. Cooper, I'm sure you heard most of that. Just as our legal representative, would you agree with that assessment? Okay, thank you very much. In the interest of time, I'll yield to the rest of the members, and if I don't get some of the other questions I have answered, I'll come back to you. Thank you.
Before we move on, I've got a few questions, and then we'll come to you, Council Lady Johnson. I had a little confusion over, and I'm the first to admit that I am not an attorney, although sometimes I feel like I'm playing one on TV up here. The health department answers over Core Civic does this, or am I calling them the right name? But the CCA, the jail does this. This is their policy. This is their procedure. When I looked through and when I read this, the request for quotation that really explains the services, there are a few places in here specifically, and I'm happy to hand this down. We've got a few extra copies where it talks about that the manuals and policies and procedures regarding health services and other services and everything from grievances of their employees to grievances of the inmates. It says that the manuals will be approved and written with Metro and things like that. And I understand if you were new on this job, it might not be up to date on that. But when I read this document, it says that to me, it implies that these policies and procedures that the Core Civic is doing have been signed off by Metro. And so I'm a little concerned when I'm hearing well, if we were giving the health, we'd do it this way, but they're doing it. How are we not taking responsibility for what they're doing if we have to approve it according to the RFQ? I'll turn you on. Go ahead.
My response is specifically because I haven't had a chance to go through those policies, procedures, and see what they look like. So I can't speak to a hypothetical. And I would say that within the department, not myself, Dr. Paul probably can speak more to what our oversight responsibilities are and how that goes.
So Dr. Paul, did you or the previous person in this position, this implies to me that someone in the health department signed off on their policies and procedures that they do internally. Is that not the case?
I believe that's the case. I won't tell you now that that we've completed our investigation about the procedures being followed that might be directly relevant to rash illness, which is kind of the specific question that's being asked here. In a general sense, yes, as the vendor of Metro that we are overseeing, the RFP and the contract require them to meet national standards, which are nationally available, and then their policies and procedures would be something that we had reviewed and signed off on. Now, we have a set of things that our contract monitor on site is reviewing regularly, daily, weekly, and monthly documentation of things that are occurring within the health and medical services part of the Core Civic facility. And so we are on a daily basis ensuring that if somebody asks for a sick call, that they get a sick call, and various parameters that are set out in our monitoring of the contract. We also, if there are particular events and adverse events, we have access to all their records at any time. But the particulars of procedures they might have followed with suspected rash illness in January, February, March, April. We're still investigating that, and I can't tell you whether there's a divergence between the procedures and what they actually did.
But the policies and procedures that they, in theory, should be following are policies and procedures that we, Metro Health, have signed off on. Is that correct?
I believe so, yes.
Okay. And you had said, I believe you said that around June 10th or June 13th was the last new case.
That's correct.
Okay. And so if, I guess in this, maybe going down the scabies rabbit hole that I might regret that we go down, on a timeline that is on the yellow sheet for y'all council members is what I've put together based on some emails and news reports and things. So I'm not saying that this is perfectly accurate and things like that, but based on the emails and things that I've put together, it says that June 1st was when inmates were being treated. And so inmates were not going to go back and forth between the Birch Courthouse and the jail, so they could have that treatment on June 1st. And so I'm wondering if we treated everyone, why it is that we're still having new cases later, if they were being given the treatment to prevent what they currently have or prevent them from contracting the scabies.
So on June 1st was not the date that we treated everyone in the entire facility. We were focused on clusters of cases that had been reported in the women's units, and the women are a different population from the rest of the facility because they are folks that would have been in jail. So they're pretrial detainees that were located, as a group, they're located at the Core Civic facility while the new jail is under construction. I'm sorry. So we were focused on the women's unit, and I think the latter cases we became aware of were in the men's unit, and that's what prompted us last weekend to make sure that we had treated the entire facility.
Okay, and so just to confirm, your last new case in the jail was June 13th, but no new cases at the IOD was June 19th? Is that correct?
Correct.
And do you feel confident that we won't see new cases? I mean, I realize...
I would say, part of what we've done over the last week or two is ourselves go back through all the hit call logs at Core Civic, and we are identifying new cases we didn't know about. But they're not recent cases. You get it? So they're people who had been ill, had been treated or not treated in previous months. And so as we sift through what we've got from the IOD clinic, we may find some that are, it's not really looking like scabies, but it was treated as a precaution, and we'll find some that look like scabies. And so, and there still may be people who have not sought medical attention yet, because scabies can last a while. So I think we're not done with counting and monitoring for cases either among the detainees or among the employees. The incubation period, again, can be up to 6 weeks. And so we'll be wanting to monitor closely for 12 weeks plus after we think that we've got we've seen the end of the outbreak.
Okay. We're going to move on to Council Lady Johnson and then Councilman O'Connell. I guess the last thing I wanted to say on this is what is confusing me from our previous discussion and this discussion is, in my mind, I'm picturing like a Venn diagram. And when y'all say that we've treated everyone, yet then you're talking about new cases or somebody who didn't report, I would just think if we treated them, it shouldn't come back up. But we can discuss that later. And so we're going to go to Council Lady Johnson now.
Thank you, Madam Chair. I think my question would like to address to Sheriff Hall. I just received this lots of packet right before I sat down the chair, so I do not have any specific from that packet. So my question will be rather general. You stated when inmate have scabies, like whatever the symptom, you rely on that inmate to report that whatever the symptom might be to other nurse, in this case, Core Civic nurse. And if by any chance inmate felt like their claim was fairly treated or their claim was not heard, is there any mechanism or procedure for that inmate to accelerate their claim?
Yes, so what should happen is that the inmate feels like the nurse or the medical staff didn't address the issue or didn't pay attention or prescribe the right, then they're to file a grievance. It's right, and that's all documented. The person should then, they have a handbook on what to do. And so we would ask them to file a grievance to tell us that that's the problem. That's all handed over. It's reviewed by a grievance officer. In our system, I can't speak for CoreCivic because I don't, but that's what should happen. And I'm quite sure they have that in place. I'm not saying it happened in their system. But you would want the inmate first to sign up himself or herself, and then if that treatment isn't adequate in their mind, they are to file a grievance, and that's how we would go and investigate. And quite frankly, that's what the monitor's roles are, is to let the monitor look into claims like that on site.
So in the future, if this type of outbreak happen, do you have any preventive measure in place currently?
We would go in the direction of the health department. That's what we would do tonight. That's what we did a year ago. And I want to make sure, just to be careful, I think Madam Chair was talking about that we don't have any new cases. We're going to have new cases. I mean, for as long as you're going to have a jail in Nashville, you're going to have scabies at some level. The word outbreak is kind of something we need to define, and I don't mean tonight, but I mean, that's something to think about. And what I would want to happen, and I think what you would want to happen, is that the medical staff look at the individual, make a determination about what we do, and then we ask them, are they contagious? That's not the official word, but are we able to house them in general population? If the answer is yes, we're moving them through courts and visitation and programs. But if they say no, we better assign them into what is isolation, where they cannot be in contact with family and visitors and attorneys and so forth, so no one is exposed. That's the system. You would hope it works all the time. Our jail may or may not do it right all the time, but I think it's only fair to bring that up. If it was us running an institution, you'd still have scabies in it. You would just hope you wouldn't expose people to it. That's all I know that the issue is out there. So just be mindful of it. It's very tough to ever get rid of it. We have lice problems throughout the year too. We have the flu. It's very similar to that. Trying to manage the flu in a jail like this is virtually impossible when it gets inside. So we have a lot of problems throughout the year that we're managing, and today it's just scabies.
Thank you. Going back to the question to Dr. Paul, you said a scabies incubation period is as long as 6 weeks. And currently there might be somebody who may not be treated. So in that sense, is it still possible you might find a new patient? Or if the person is not treated, why not?
Thank you. And thanks for the question. So the question is, might we see more cases? And yes, we might see more cases. In anything like this, I mean, even when each of us go as individuals to our doctors, there are times when the treatment doesn't cover everything it needs to, and the illness or infection might come back. Now, in offering the preventive dose to everyone detained there, some of those folks have refused it. So it's possible that there are folks, and we ask them to go back a week later and offer it again. We ask them to monitor those people for onset of rash illness, and at the moment they complain of rash illness, to put them into isolation and not let them transfer or travel, and make sure that they get evaluated and treated in a timely way. That's all part of our that's all part of what we've directed CoreCivic to do. But yes, we might see cases that break through the interventions that we've taken.
Thank you. So as far as you know, the person who showed the symptom has been treated. However, the person, because of the incubation period, does not show the symptom, has a right to refuse, and you honor that refusal. Is that a fair statement to say?
I think we can ask the attorneys in the room, but the circumstances under which medication is forced upon an individual who refuses it are pretty extraordinary.
And is there, I know it's kind of hypothetical, but if something such as disease or skin disease or very spread kind of a disease happen in such a contained period, do we force everybody to take preventive measure? Is it legally allowable, or still in that case, if that people does not show symptom, it's we have to honor those individuals' wishes? Is there any disease we have to override individuals' wish to be preventive care to be treated?
So an example that's pretty common the sheriff referred to is tuberculosis. And tuberculosis is totally preventable. It's totally treatable. Some people with tuberculosis have very complicated lives. They may have mental illness. Some people with tuberculosis, even though we may tell them it's treatable and it's curable, refuse medication. We do have, in the state of Tennessee, measures that we can take to isolate someone who refuses treatment. I don't think it's very often that you'll find anywhere the idea that the state or the government can force someone to take medication, but what we can do is isolate someone who's refusing the treatment. I can be corrected by any of the attorneys in the room. Right? I'm right.
Thank you.
Thank you, Madam Chair. Sheriff Hall, I think it's necessary to have the conversation that you've helped us kind of lead us through here about the reality of the situation here in terms of the, not just the legal, but the practical ramifications of this contract, right? And I think similarly, thinking very carefully about the fact that, yes, I mean, there are so many scenarios where you've got groups of people in constrained spaces, and yes, I mean, it's like, having been through the preschool and now kindergarten experience myself, you see those kinds of things where fevers and all that stuff, and thinking through what it means to have an outbreak is a good and worthy challenge. I think, though, I'm want to stick to something else you mentioned, that this idea of a healthy exercise. What can we do in this body to kind of make sure that gets facilitated, right? Would it help you to have a resolution from these committees, a letter? How can we facilitate ensuring that healthy exercise is actually conducted? Thanks.
That's a good question. One thing maybe I didn't explain well, that believe it or not, you don't know how thankful I am sitting here with Dr. Paul. This contract's been in place for about 26 years, I believe. And when it was first put in place here in Metro, there was contract monitoring, i.e. the sheriff's office, I think, on site as a monitor, and there's someone from the sheriff's office been there for many, many years. But a few years after I got elected sheriff, which is probably 14 years ago, somewhere in that time frame, I went to the mayor's office then and the administration and said, I want a medical staff out here overseeing medical. That is not what we do. And to be honest with you, if I was sitting here trying to answer some of this complicated matter, you would ask me my qualifications and anyone that I have out there, and we don't have those. So the city, believe it or not, back then was fortunate to have done that, because I trust that they know what they're doing. I trust that they're trying to keep a company in compliance. And I'm not saying it works all the time. But I think there's some good news that the government is not just handing off what's going on. I surely am not excusing some of the confusion that's happened and some of even the exposure. But I think that's what we ought to try to think about. As long as we're going to have a contract as it is, you would want people with the expertise to oversee such a thing. And historically, and for the first, 16 years or so, that wasn't done well at all. And so the government did the right thing in putting the right people there. I think the question was asked maybe by Madam Chair about how are the policies approved. One of the things that's important is when you write a contract like that as a government, you would want to require them to meet certain standards of care that are nationally accepted and so forth. And then my belief is the role of the monitor is to ensure that they follow that standard of care, which is a national expectation. So I think policies are there. I mean, I know that. And I think we have monitoring there. I think there's improvements, and I'm listening tonight thinking about things that we may could do better in all sorts of ways. I think it's fair to point out if the sheriff's office is running it, as much pride as I have, we're still going to have scabies and we may have outbreaks. I would just hope we would handle the crisis in a way that this community would feel trusted, that we would fix it and move on. And right now, that's our goal. Let's find a way to do that. And I hope, and I don't think a resolution or a request or an apology, those aren't bad things at all. I think we need to do those types of things. But we also should, and I was just reflecting as I was thinking about it, how bad this would be sitting up here if it was just the sheriff of the county trying to explain it. We have the expertise on site, and we need to trust that they're going to make sure that it works.
And just to follow up and maybe add some clarification, I think part of that healthy exercise too, though, is making sure that we have a sense over the next 3 years of what that fiscal portrait might look like of if you all were to expand your footprint into that facility.
I failed to mention, I'm glad you, the other thing that I really respect and appreciate about what Councilmember O'Connell and I had a conversation unrelated to a crisis, which is this, was that I think the city needs to take a look if that's, and again, we're talking about 2020, I believe it is, because it would take us a year or more as an operation ourselves to kind of put together a package that would tell you what would it mean to the city and how, the cost and so forth. It's a complicated situation. And obviously some negotiation with the state about what their commitment would be. But I'm committed to doing that. I've told you that already. And regardless of what we're talking about tonight, it's the right thing for the city to understand the cost, understand the operation. And I think it's a good time to do that as we approach it.
Thank you, Madam Chair. I was trying to get my tweet in, but thank you, Sheriff. Thank you, Director. My question is more so for our legal department, Director Cooper. 26-year contract, expected to terminate 2020. We've heard the sheriff's concerns. As a body, what's the process for that contract to be terminated? Is that with the mayor's office? Is that with the Metro Council? What would be that process? So as a body, we can go ahead and start thinking about what that is and what's required from us on our end, or is that something that doesn't necessarily have to come to this body?
Sure. Because this is a procurement contract, it goes through the purchasing agent. Although there has been a contract for 20-something years, it hasn't been the same contract. It was most recently awarded to CCA in 2015. Purchasing contracts have a term of 5 years. So there was an RFQ process. The CCA was selected as the winning bidder. I'm not sure if there were other bidders or not, but so it's a 5-year contract. Since it's a purchasing contract, it's not approved by the council. There's no requirement. Now going forward, there are, I think that with the new ordinance the council put in place, that may not be the case, but at the time there was no requirement that it be approved by the council. So if there were grounds for termination, that would be done. Really, it would be the sheriff's office and the health department together making that recommendation to the purchasing agent, and then they in turn would work with our office to draft that letter. But at this point, there are no plans or grounds for termination that we have identified.
Thank you, Director. Just want to make sure, we have legislation floating around in this body where we don't necessarily have the authority to do certain things. So just wanted to make sure.
Thank you. And so I don't have anyone else in the queue right now. And so I'd like to thank the Sheriff's Department for coming, the Health Department, HR, and all of our assorted departments, legal, and everyone who came tonight and helped show our employees and the city of Nashville the importance of this issue. I will draw attention once again to the fact that CoreCivic did not feel the importance or the responsibility to us who pays for this and the taxpayers of Nashville to show up tonight. And so thank you all for coming. I think we've had a good discussion. I think we've got a lot of areas that we're going to work together moving forward. And I know that this is not going to be the last time that we're all together. I'm sure you all look forward to that. So thank you so much, and thank you, council members, for being here. Thank you. Thank you. I will. Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.